Welcome back to 12 to Your Health. I'm Dr. Derek Da Silva in for Janine Srafasi. Each year, more than 600,000 people worldwide undergo knee replacement surgery. The reasons vary from injury and arthritis to infection. Well, there's another option more active patients may be able to consider. It's called partial knee replacement. Here to talk about this procedure is Dr. Robert Kayal, an orthopedic surgeon in Ridgewood, and also joining us is Mr. Frank DiGiamo of Saddlebrook. Frank is a patient of Dr. Kayal who underwent the partial knee resurfacing procedure. Gentlemen, thank you very much for being here.
Thank you for having us.
Dr. Kayal, talk to me first about what the most common reason is. I mentioned infection, I mentioned arthritis. What do you see as the most common reason?
Clearly the most common reason for performing knee replacement surgery in general, and specifically partial knee replacement surgery, is a condition called osteoarthritis, where the normal cartilage is worn off the end of the bone, and patients encounter a condition we call bone-on-bone arthritis, most typically from normal age-related wear and tear osteoarthritis of the knee.
Mr. DiGiamo, you had this procedure done how long ago?
5.5 years ago.
So, but what I also understand in talking to you before we came on here was that you had a total knee replacement in one, and how long ago was that?
That was almost 14 years.
That's for the total.
Right.
And the partial one done 5 years ago?
5.5 years.
What did you see as the difference between the two?
The discomfort, the pain level, there's nothing compared to the total knee replacement.
So there was much less pain with the partial?
The partial knee replacement, I went in on a hospital on a Wednesday, came out on a Thursday, walked into his office on a Monday without a cane and no pain.
Wow. Wow. I mean, I know that a total knee replacement, Dr. Kayal, is something that's extremely painful, right?
It is, relatively speaking, much more painful than the partial knee replacement surgery being performed through a minimally invasive approach, absolutely.
Yeah, right. What we have right now, I guess, is, can you just walk us through this demo?
Sure. This is a computer animation of a total knee replacement being performed. You can see the femoral component being installed onto the end of the thigh bone and the tibial component installed, and then in between there's a plastic articulating spacer, and now the knee is reduced after the operation, and that's the new total knee replacement cartoon images.
Right. And now we also have some video that we're going to be showing of what the partial looks like. But before, oh, here we go. You can just talk us through this?
Sure. In contrast, here's a cartoon image of a partial knee, osteoarthritic knee. When there's diseased cartilage, there's wear involving only one of the three compartments of the knee. This cartoon is showing bone-on-bone arthritis involving the medial side of the knee, and the other 2/3 of the knee are otherwise pristine, free of any disease.
Right.
And thus, in this particular patient, a partial knee replacement is being performed through a small incision, only performing a resurfacing of the disease and involved compartment of the knee.
So it's only on one side versus both sides. Is that the difference here?
Yes. Well, actually, there's three compartments to the knee. In this particular cartoon rendering, there's a replacement of one of the three compartments. I believe later in the video we're going to look at the patellofemoral joint, which is the joint underneath the kneecap, and then the other compartment, the lateral compartment, which was free of any disease and therefore not replaced. Only one of the three compartments is being replaced with the partial knee replacement.
Now, who is a candidate? Well, let's talk through this one also. Talk us through this.
So again, showing just a different view of this knee, you can see.
And this is the back or the front part of the knee?
This is looking right now at the front of the knee.
Okay.
And the replaced side is involving the inner side of the knee. The front part of the knee, the patellofemoral joint underneath the kneecap, is on top, not being replaced, and the outside of the knee, the lateral compartment, is also not being replaced. So 2/3 of the patient's normal anatomy is preserved, and therefore the incision can be a lot smaller, and the bone resection can be a lot more conservative.
Who typically is a candidate for a partial knee replacement?
So candidates for partial knee replacement are patients that present with disease that involves only 1/3 of the compartments of the knee. So either the medial side, the inside, the outside, or the front side of the knee, where they have symptoms that match where their x-rays reveal disease. So approximately of my total joint replacement population, I would say on average probably anywhere from 5 to 7% of my patient population would be a candidate for this special procedure.
Now, Mr. DiGiamo, talk to me a little bit about what, how did you find out about Dr. Kayal, and how did that whole process happen? Because obviously you had arthritis in your, is that what you had, was
Yes.
arthritis in your knee?
Yes.
And you heard about the partial thing and you just got in touch with him? Is that how that worked?
I didn't know anything about the partial until I went to see him.
No, did he do your total?
No.
Somebody else did the total?
Somebody else did that almost 14 years ago.
Yeah, he probably wasn't even around. He looks like a
No.
baby anyway, but anyway.
I
go
always
ahead.
ask him that.
Yeah. But so you had the partial done. What was your rehab like?
Easy. Like I said, I walked into his office without a cane. The next couple of days I started rehab a couple times a week. And it was just...
And today you are running around...
pain-free, nothing. I haven't had a bit of pain with this knee at all.
All right. What does a typical patient look like, Dr. Kayal, that comes in to see you that would be a candidate for this?
Well, the typical patient is the same as the typical patient for a total knee replacement, but some people end up just getting disease involving only one compartment. My patient age range has ranged from patients in their 30s all the way to patients in their mid-80s, and some people just end up wearing one compartment of the knee. They're just genetically predisposed to only wearing one part of the knee. Some people, for instance, have had meniscal surgery or arthroscopic surgery in the past where a certain amount of cartilage was removed from one compartment, and this is not in fact post-traumatic wear and tear, but because of a trauma they perhaps had a torn meniscus, underwent arthroscopic surgery, and due to that cartilage loss ended up developing arthritis in their knee prematurely, and the other 2/3 of the knee was uninvolved, and so these would be perfect candidates for a partial knee.
Well, we've got a little bit of time left here. Just very quickly, cost and insurance coverage. Is it covered?
It is a procedure that is FDA approved and completely covered, yes.
And it is probably less expensive than a total knee replacement, I would imagine, right? I mean, just...
I believe it is. I'm not really sure about those details, but given the fact that, as you can see from the models, the size of the metal involved and the hardware involved is certainly much less significant than the components involved with a total knee replacement. So I believe it would be less
We've got
expensive.
just a couple of seconds left. Frank, any closing comments?
I know that on my total knee I had arthroscopic surgery first, and then later on I had to have the total.
Right.
But he did the partial, and I'm so happy with
Wonderful,
it.
wonderful. Dr. Kayal, closing comment?
Well, I just think that this is, in the right ideal patient, it's a fantastic operation. I routinely perform this now as an outpatient through a 3 to 4 inch incision. There's no blood loss involved, requiring blood transfusion, and patients retain the majority of their normal anatomy and have had an outstanding result.
Great. Dr. Kayal, Frank, thank you very much for joining us. Pleasure having you on the program today. And once again, folks, if you have any questions or comments about today's interview, or there's a topic you'd like to see discussed in our program, email your thoughts to us at 12toyourhealth@news12.com. Stay with us on 12 to Your Health. When we come back, I'll discuss the dangers of a commonly used winter clothing accessory.